laging handa. TXTFIRE volunteer, laging
Hello! Welcome everybody! Magandang hapon po sa inyong lahat. Napakaswerte po natin ngayon na itong first TXTFIRE Itanong kay Doc. No? Kasama natin ngayon ang pinakamagaling na infectious na doktor. Ha? Laging ano yan, ang hirap na ma-invite, no? Dahil nga sa kaibigan natin at alam niya sa mga volunteer at para makatulong sa kapwa, no? Isang tawag ko lang, oo agad siya. Kaya maraming salamat Doc Benji ko. At hindi na tayo magtatagal kasi medyo mahaba ito at para marami tayong matanong kay Doc, no? Sir Jeric, baka pwede natin i-introduce ng pinakamagaling natin doktor ngayon.
Okay, thank you. Magandang hapon po uli sa inyong lahat. In behalf of the officers and members of TXTFIRE Philippines, napakasaya po namin ngayon na nandito po tayong lahat para matuto at nandito po I'm very honored po to introduce our man of the hour, no? He is no other than syempre Dr. Benji ko. Pero bago po yun, papakilala ko lang po ng konti, no? Si Dr. Benji po is graduated 1979 BS Math cum laude po sa UST College of Science. 1983, Doctor of Medicine sa UST Faculty of Medicine and Surgery. 1985 naman po, graduated Masters of Science in Applied Math, UST Graduate School. And in 1992 po, he had his fellowship in Clinical and Molecular Pharmacology at Boston University Medical Center in Massachusetts, USA. He is also the author of 46 local and international publications and editor of 9 textbooks and handbooks in pediatrics, pharmacology, and pharmaceutics. No? At sa experience naman po, talagang, sobrang dami experience. He is currently an active consultant in pediatrics with subspecialty in infectious diseases and clinical pharmacology at the UST Hospital, Asian Hospital, and Cardinal Santos Medical Center. He is also the chair, Committee on Publications, in Therapeutics and Toxicology of the Philippine Pediatric Society. He's also the chair in Research and Ethics Committee of the Asian Hospital and Medical Center. He's also a faculty of the Ateneo de Manila Professional Schools. She's the chief section of Pediatrics Infectious Diseases at the UST Hospital. He's also the chair in Pharmacy and Therapeutics Committee of Cardinal Santos. Also in 2018, up to 2018, he was director for Center of Drug Regulation and Research of the Food and Drug Administration. In 2016, he was consultant for the Center of Drug Regulations and Research of the FDA as well. In 2017, he is executive director, technical consultant for the Center of Excellence for Drug Research, Evaluation, and Studies Incorporated. In 2016, he was the medical director of Otsuka Philippines Pharmaceuticals. In 2014 naman po, he is the chairman, Department of Pediatrics of the Asian Hospital and Medical Center. In 2014, he was the chair of Pharmacy and Therapeutics Committee, Asian Hospital and Medical Center. And from 1985 to 2008, he was professor in Pediatrics and Pharmacology. From 1990 naman to 2014, he was the professional lecturer in biostatistics and biopharmaceuticals of the Graduate School and Institute of Physical Therapy of the University of Santo Tomas. Sa sobrang haba, sa sobrang dami po ng mga accomplishments niya, nakakabulol talaga. And hindi ko na po patatagalin, I would like to introduce none other than Dr. Benjamin ko. Palakpakan po natin. Yes. Hi, Doc.
Hello. Magandang hapon po sa inyong lahat. And I hope you don't mind if... thank you for that very long introduction. I thought Jeric was going to give that talk already. Anyway, so let me start with the talk for this afternoon. I hope you do not mind if I do it in Taglish. I think it's more convenient on my part. If you have any questions, then let me know. Okay, so I'm sharing my screen already. Can everybody see the screen? Can I get the feedback? Nakikita na ba ninyo yung screen?
Yes, Doc, we can see the screen now.
All
Thank you,
right,
Doc.
okay. So
By the way,
let's
Doc,
start.
Rosh will be here to be the moderator. So kung may questions tayo, she will be asking the questions in behalf of the people who are watching us online.
All right, okay. So this job is for you is the title of my talk this afternoon, and this set of slides are actually specific for lay people. So what will I talk about today? Medyo marami tayong pag-uusapan, pero iiklian ko po para naintindihan natin lahat kung anong pag-uusapan natin. So what I'll talk about are only three things. No? First is to discuss the most asked questions on COVID-19 vaccines. And of course, allow you to do a little Q&A. Maraming tao na nagtatanong kung on safety, efficacy. Actually, marami pang tao hindi naniniwala na may COVID eh. So, pag-usapan natin kung bakit totoo na meron at bakit kayo hindi makapaniwala na may COVID. The second is to help you understand how vaccines work, why they are part of the solution to the bigger picture. Kasi hindi naman natin pinopromote ang bakuna dahil hindi lang natin gustong magkasakit. We are promoting vaccines as a way for reopening the economy. And we have to remember that both the economy and health hinge on each other. So they're dependent. Kung masyadong maraming sakuna at masyadong maraming nagkakasakit, pati ang ekonomiya ng bayan na apekto dahil sa sakit na yun, yung mga disease outbreaks. It does not have to be COVID alone. It can be a polio outbreak, it can be a dengue outbreak, but any outbreak of any infectious disease, malaking dagok yun sa ekonomiya. And of course, the third is how can I help allay your fears by addressing the myths and fallacies, yung mga kung ano-anong agam-agam at kung ano-anong mga umiikot ng mga iba't ibang gamot na pwedeng gamitin at yung mga hindi totoo tungkol sa mga iba't ibang klaseng bakuna. So, nasa na ba tayo ngayon sa pandemya ito? And this is actually an article that came out in Bloomberg. Bloomberg is a media outlet. And it showed that the Philippines was an economic star until COVID-19. As a matter of fact, because of COVID-19, among all of the countries in Asia, we are now in the bottom of the list. So, once upon a time, we were the economic star, but it took one virus to make us the worst performing star in the country. And this is the evidence. Di ko datos to ng Department of Health, ng pamahalaan po natin. So as of yesterday, we have 631,320 cases nationwide, with 4,437 additional cases yesterday. Today, we will be around 4,500, somewhere there, or 5,000 cases, but definitely we will not go down to 2,000. Why? Because we are on an upward trajectory. Unless may milagrong nangyari, hindi po mangyayari. Pataas po ang ating mga kaso. And if you look at the data between August 6 to 12 of 2020, this was the highest week we had. Just for this week, we had 21,740 cases. So that's around 3,000 cases a day. You look at March 4 to March 10, we had 24,892 cases. That's 3,500 cases a day. So this large increase tells us that in July to August of last year, swabe tayo umakyat. No? Ngayon, ang akyat natin ang bilis. Doble-doble tayo linggo-linggo. So nasa na tayo nga ngayon? At paano na si Juan at ang bawat Juan? Kasi mahirap po i-balance ang healthcare system at saka and of course the economy. A lot of people always talk about, well, kasi, kailangan magbukas na tayo ng trabaho, kailangan gawin na natin to kasi masyadong maraming naghihirap. Totoo po yun, tama po yun. Pero at the same time, it's not only us that feel this. Everywhere in the world, they are feeling the whole economic impact of the pandemic. And it has something to do with the healthcare system as well. Kasi fixed po ang healthcare system natin. There are finite sources for the government and the private sector. It's not like I can overnight build a hospital just to fit all of the COVID patients. Hindi po ganyan. Most of the private hospitals within Metro Manila or any part of the Philippines will not give up all of their beds for COVID patients. They will only give up, as mandated by law, 30% ng kama nila ibigay nila para sa COVID. Bakit? Kasi may ibang mga pasyente po sila. Wala naman tayong COVID-exclusive hospitals dito sa Pilipinas. And even the government hospitals that give up more are already full. And you have to understand na masyadong maraming tao na nasa National Capital Region. Almost 15 million po tayo na nasa 660 square kilometers na lupa. Which means for every square kilometer ng lupa sa NCR, sa Metro Manila, 23,000 tao ang nakatira doon. And the highly congested situation in Metro Manila allows the transmissibility of the infection. So we should be more prepared. We should be more prepared at that. And because we've been living in a year of lockdowns, we should be able to address how we live with the virus, because there is no way that we will not be able to live with the virus, because that virus is here to stay with us for quite some time. And of course, we need to work at solving the problem together. Hindi pwedeng kanya-kanya. Hindi pwedeng dahil ako lang, gusto ko, ganito. Kasi tayo-tayo ang nagkakaproblema. And I hope this talk will convince everybody on why we need to work together and why we need to understand that there is a pandemic and work at helping each other get out of the pandemic as a whole. Of course, I'd like to emphasize on vaccines. And the reason why I'd like to emphasize on vaccines is because this is actually one of the key to getting out of the pandemic. This is visual proof of why vaccines do more good than harm. Ito po yung mga timelines kung kailan nasa ilalim, kailan na-lisensya itong iba't ibang mga bakuna. No? So these are the different vaccines actually that have been invented or discovered, if you want to put it that way, at a certain point in time. Example, the vaccine for polio, diphtheria, pertussis, and measles was discovered in the 1940s. No? Hepatitis B was discovered in sometime in the 1960s, if I'm not mistaken. So if you look at what happened during the discovery of the vaccine and the implementation, kasi that means that from that time na na-discover yung vaccine na yon, and then the vaccine program was rolled out, you will see that the number of cases dwindled over a period of time. So ganun din kay hepatitis B, ganun din kay pertussis, kay polio, kay diphtheria. Unfortunately, some of the diseases made a return, katulad ni pertussis, no? Bumalik yan, yung tosperina. Measles had a large comeback also. Chickenpox. And some of the other diseases make a comeback, not because of the vaccine not being effective, but because some people developed that anti-vaccine concept. Yung iba, ayaw magpabakuna. Yung iba, hindi naniniwala. Yung iba, talagang hindi naaabutan po ng bakuna. So, because of this, some of the diseases come back, but we call it vaccine-preventable disease in the sense na dahil sa bakuna, mas maraming nawawalang sakit na kailangan mawala at dahil kailangan mawala kasi walang gamot dito sa mga sakit. Now, how do the 4 different types of vaccines for COVID work? There are actually 4 main types of COVID vaccines. I'm sure some of you are familiar with it. Yung inactivated virus, ito po yung sa Sinovac, Sinopharm, at saka yung Covaxin ng Bharat, no? Bharat vaccines, their vaccine is Covaxin. Ito yung pinuntahan ni Secretary Galvez sa India. Tapos meron din Novavax na pinuntahan din niya. This is a protein subunit-based vaccine, which I think will be made available also in the Philippines. Tapos meron yung sa Pfizer at saka sa Moderna. Ito yung mga messenger RNA, mga nucleic acid vaccines, at saka yung viral vector vaccines. Ito yung sa Oxford AstraZeneca, yung sa Johnson, yung sa Russia, at saka yung sa China na CanSino Bio. So these are the 4 different types of COVID-19 vaccines. They are different brands, but they have 4 different platforms. So pag sinabi mong Sinovac ang natanggap mo, ang type of vaccine na yon ay ang tinatawag namin na inactivated vaccine. Pag yung sa Pfizer ang natanggap mo, ang type of platform ng vaccine na yon is the messenger RNA vaccine. Kung yung sa Oxford AstraZeneca ang natanggap mo, it's called a viral vector vaccine. Pero hindi mo pwedeng ipagpalit-palit itong mga bakuna kasi iba't iba ang kanyang plataforma. Bakit mo kailangan mabakunahan? Kasi pag nabakunahan tayo, yung vaccine na yon protects you. Okay? But that's not what you want to do. Kasi ang tawag nun, swapang, kung ikaw lang ang magiging protektado. At kung isa-isa lang tayo nagpapaproteksyon, isa sa 10, ako lang ang protektado. Paano yung 10? Tatandaan mo, may mga tao sa lipunan na hindi pwedeng mabakunahan. Dahil, kunyari, katulad yung sa COVID na bakuna, wala pang indikasyon para sa mga bata. At wala din indikasyon para sa mga ibang tao na may malubhang sakit. So those that have very severe illnesses, like they have cancer, or that they are on medications because they just had a transplant, or that they've just had recent surgery, or that they are pregnant in the first trimester of their pregnancy, we cannot immunize them. But we need to protect them. And the only way we can protect the others is when more people get immunized. And that's what we call, that's what we want to do with what we call herd immunity. Ito pong example noon. Look at this is when no vaccination occurs, okay? So if you look at the little people here that's drawn, hindi ko alam kung anong kulay ito eh. Sabihin natin pink. No? Yung dark pink na kulay na to is a person who is sick. Okay? And then all of the blue people are actually those that are susceptible. So kung meron kang isang tao na may sakit, lahat tayo dahil wala tayong bakuna, pwede tayong magkaroon ng COVID. So itong isang taong may sakit, makakalipat sa ibang taong walang sakit. Now, that means what's going to happen is that eventually everybody else is going to get sick. Kasi mabilis siya maglipat. Ito lilipat niya kay dito lilipat niya kay dito lilipat niya dito. At kung ang tinatawag ng mga eksperto, yung R0 o yung RT, yung reproduction rate, 1:2, so bawat isa na may sakit, 2 ang mahahawak kaagad. Kaya nga ngayon sa NCR, ang reproduction rate natin sa COVID ay 2. Noon, less than 1. So that means pag less than 1, pag isa nagkasakit, ni isa hindi magkakasakit. At yun ang habol natin. Nagkataon, for some reason, one reason or the other, whether it is the variant o dahil nagpabaya na tayo, dahil nagsawa na tayo sa pandemya, dumami. At dahil dumami, pati ang reproduction rate natin tumaas. So instead of the R staying at less than 1, the reproduction rate is now at 2. So sa bawat isang taong nagkakasakit, 2 ang nahahawa niya. And the reproduction rate of COVID is actually somewhere between 3 to 5 at the maximum. So ayaw natin makarating sa isang sitwasyon na sa bawat isa na nakakasakit, 5 ang mahahawa kaagad. So this is what happens when there is no vaccination. So isang magkasakit, eventually, lahat magkakaroon ng COVID. So the infection passes from individuals who are sick to those that are susceptible, and we are all susceptible. Why? Because we have no antibodies. Wala tayong bakuna o wala tayong protection kahit na papano sa virus na to. Let's say for granted, magbakunahan na tayo. So, paano kung kukonti lang yung nabakunahan? Ito ang mangyayari kung kukonti lang ang papayag magpabakuna. Because the infection can still pass to susceptible individuals and spread throughout the population, except to those that get vaccinated. So, kunyari, ikaw ito yung may sakit, ito po yung pwedeng magkaroon ng sakit, yung kulay blue, tapos yung beige dito, yan yung nabakunahan na. So, yung mga nabakunahan na, sila na yon, hindi na sila magkakasakit. Pero yung mga kulay blue, dahil etong taong to may sakit ay nakakahawa, yung mga hindi nabakunahan, mahahawa pa din. So ang mangyayari niyan, lahat ng mga nabakunahan na to, hindi sila magkakaroon ng malalang sakit, yung mga hindi nabakunahan ay magkakasakit. So you just change the color now. So all of those that are in blue are all now sick. That's the reason why you want to have more people getting immunized. So what should happen is this one. Why? Because when more people now get immunized, one person that gets sick, it's going to be hard to transmit the infection to those that have not been immunized. Kasi mahihirapan na siya maka-infect ng mga taong yun. Kasi he will need to infect someone. But the one that he infected is immunized. So the one that is immunized cannot infect somebody else. And so on and so forth. So pag mas maraming bakunado sa ating community, mas konti po ang nagkakasakit. At yung mga hindi na bakunahan ay maaaring hindi magkasakit din. So infection cannot spread in the population, and people are indirectly protected by people who get immunized. Now, like I said, these are the different types of COVID vaccines. Ito po yung balik tayo dun sa kwento ko. These are the mRNA vaccines. Ito po yung kay Moderna at saka kay Pfizer BioNTech. We do not advocate the live vaccine, so this is not something that is useful. And then you have the inactivated. Magandang inactivated yung sa Sinovac, Sinopharm, at saka yung sa Bharat. And the reason for it being nice is because it's a whole cell, buo yung cell na yun. And they just need to add a chemical in order to kill that particular virus. Tapos meron yung subunit, ang tawag namin doon, subunit protein, yung isang parte lang ng virus ang kinuha para mag-stimulate ng immune response sa atin. Tapos, kilala ninyo si AstraZeneca kasi nandun na siya sa dyaryo natin na tumating na po itong bakuna at saka yung isang bakuna ni Sinovac. Among them, this is the only one that has not been studied in the past. Okay? So, lahat itong mga forms, yung inactivated, subunit, kasi sasabihin, oh, bago na naman yan, makakamatay yan. Sa totoo lang, itong inactivated, subunit at viral vector vaccines, matagal na pong nagawa. They are platforms that have been used in the past. For example, the inactivated vaccines have been used in the development or the discovery of polio, because polio is an inactivated viral vaccine. Rabies is an inactivated vaccine. Hepatitis A is an inactivated vaccine. Yung ginagamit sa health center, yung tusperina, yung laban sa tusperina, sa diphtheria, dun sa hepatitis, yung ginagamit dun sa cervical cancer. Ang plataforma po niya ay the subunit protein vaccines. Tapos yung viral vector vaccines, yung ginagamit, yung plataforma nito ay ginagamit doon sa bakuna laban sa Ebola, laban sa SARS, at laban sa Zika. At yung ibang mga bakuna na natatanggap ng ating mga paboritong aso at pusa ay viral vector-based vaccine. So these are not new. Okay, they are not new technologies. The only one that is new is the mRNA. But the beauty of the mRNA is that while it has never been done before, it is also the easiest to make nowadays. Why? Because it is easy and quick to design. Ganyan ka-advanced na ang science. All you need to know is the genetic component of the virus, and you can design the vaccine based on the genetic component. So, I guess maraming natatakot magpapakuna. That's because hindi naman natin maiwasan yung mga agam-agam na yung mga myths, fallacies, yung mga hindi totoo. Pagdating sa mga ating ninuno, marami tayong pinaniniwalaan. Minsan yung mga bata, sinok ng sinok. Natataka ako, bakit may tissue paper dito sa gitna ng noo nila? Sabi nila, para hindi daw nauusog at hindi nababate. Parang feeling ko, alright, so why is there a wet tissue paper here? But we don't know that that wet tissue paper does not work and serves no purpose. So that's what we call myths and fallacy. No, yung mga bata, hindi daw dapat naliligo pag Biyernes. Hindi ko alam kung bakit, kasi baka maging duwende o baka mawala, magkasakit. Pero hindi ko maintindihan kung bakit Biyernes lang. Ano ba meron sa Biyernes at hindi pwede maligo yung bata? Tapos, dahil sa social media, ang bilis natin maniwala sa hindi totoo. Basta yung kaibigan mo nakapaglipat ng balita, dahil kaibigan mo, ililipat mo na lang yung balita na yun sa ibang kaibigan mo. Hindi mo bine-verify. That's what you call fake news. And when you share fake news and fake information, more people die. Why? Because they do not get the benefit of the doubt of getting adequately educated. You don't want your children growing up in a world where all the information that is provided to you is not true. And so the most common vaccine myths and facts are, these are the myths on the left side of the column. For example, a lot of people think it was rushed and it isn't safe. No, that's not true. You have to remember, before a drug is even allowed to get launched, safety is of paramount importance. That's the reason why we tested in animals first. If it is not safe in animals, then it will never be approved for human use, not even for the first phase of the clinical trial. So, sinusubukan muna yan sa mga hayop. It changes our DNA. Hindi po tayo magiging zombie. No? Kasi ang akala ng mga tao, pag sinaksakan ka, kinabukasan, iba ng itsura natin. Masyado tayong nanonood. Marami tayong pinanonood sa Netflix at kung ano nung paniwala na hindi naman totoo. Baka maging kagamba. It can give you COVID-19. That's not true also. It can give you some of the effects of a COVID-like symptom, but it will never give you the disease itself. Why? Because all of them have been, all of the viruses that have been incorporated are either dead or they are genetically engineered. It contains egg protein. That's not true. It does not contain egg protein, and it can be given to people with allergies to eggs. It can cause severe side effect. Well, that is true, no? But that's 1 in a million. Yung mga anak natin, yung mga bata, because I'm a pediatrician, wala tayong, we really don't mind them getting vaccine. They get vaccinated so that hindi sila nagkakaroon ng sakit. Pero pag sarili natin, nagtataka tayo, nakapagtataka na, we're hesitant to get the shot for our children. Kasi they don't have protection. And the only way you can protect them is if we get shots. If we don't get sick, our children don't get sick. So it's the other way around now. And the shoe, the shoe is now on our side. So it's on our foot. Are we willing to wear the shoe? And of course, the last thing is that it makes women infertile. Nasabi natin na nababaog yung mga babae. O kundi, nababaog yung mga lalaki. May mga nagsabi na, hindi, baka mabaog ako hindi na ako makakapag-reproduce. Pero huwag ka nang mag-reproduce, no? Kasi tama na. That is not true. There is no evidence that, people will become infertile. It's just a vaccine. You know what the vaccines do? They stimulate our body. They stimulate our body artificially kasi it's an artificial virus that stimulates the body to make antibodies para mabigyan ng immunity, protection yung ating katawan. Para kung sakaling isang araw, meron tayong makaharap na tunay na COVID, meron na tayong panlaban. May sundalo na yung katawan natin para harapin yung particular virus na yun. In the meantime, dahil wala tayong antibodies, and it is the first time we are encountering the virus, we have no antibodies. And when we have no antibodies, the first time we meet the virus, we will build antibodies by getting sick. So, there is a process in studying at pagsusuri ng mga bakuna laban sa COVID. At ito ay talagang pinag-aralan ng mabuti. So, I explained that to you, yung preclinical na ginamit muna sa mga hayop pag pumasa, saka ginagamit sa konting tao. But you will notice that safety are all endpoints in each and every phase of the clinical trial. Okay? So, yung whether it is effective or looking for the correct dose, gagamitin ko ba 3 micrograms or 16 micrograms? Itong dose finding phase, ito yung phase 2. So, ito po yung hinahanap yung optimal dose. Ito ang pinakamagandang dose sa target population. Pero kung konti lang ang ginagamitan nito, and even at this phase, safety is an issue. So they look at all of the phases that we go through before we introduce a vaccine. Safety are of paramount importance. So dapat ligtas, dapat nakaka-produce ng immune response, at dapat may proteksyon laban doon sa particular virus na pinag-aaralan. So ano ang benepisyo sa pagbabakuna? Number 1, sa sarili. We get to protect ourselves from mild, moderate, severe, and death. Okay? You have to remember that all of the studies had only 2 endpoints. The first endpoint is whether it protects you from getting symptomatic COVID, and the second endpoint is whether it protects you from getting moderate to severe COVID. The first protection may not be very good, no? That means that there will still be a few percent that can still get mild COVID. Lalo na, dahil hindi lahat nagpapabakuna. So, pwede kang na-expose doon sa mga nagpapakuna, na hindi pa nababakunahan, nakalimutan mo maglagay ng mask, so magkakaroon ka pa din ng COVID. Pero, mild. As to whether you get moderate to severe COVID, the protection is almost 100% for moderate to severe COVID. And that's good. That is good enough for me. Why? Because it is the moderate to severe COVID that is A, costly. Mahal po ang magpa-ospital sa COVID. And B, mamatay dahil sa COVID. May mga kaibigan po kayo na yumaman na dahil sa COVID, maintindihan po niyo yung concern ko na walang gusto mamatay dahil sa COVID. Pero ubos ang kabuhayan niyo pag nagkaroon kayo ng hospitalization due to COVID, eh walang matitira dahil wala kayong masasalba na tao. The second benefit is protection for the family, our loved ones, and the community. Kaya ang kwento ko dito ay, this jab is for you. Itong bakuna na to ay para sa iyo. Hindi to para sa akin lang. Kasi meron akong inaalagaan na nanay. Kayo din, may inaalagaan kayong mga mahal sa buhay. Yung inyong mga magulang na maaaring hindi na makatanggap ng bakuna dahil sa sobrang tanda na nila, naalagaan mo pa sila. O yung mga anak ninyo na kailangan ninyong alagaan at kailangan ninyong magtrabaho para sa kanila. At ang pinaka-importanting benepisyo ay this is the only way we can actually reopen our economy. Remember what I said, that there is a very delicate balance between health and the economy. And healthcare has an indirect impact on the economic revival. And this is not felt by the masses. Nakakalimutan natin. Nakakalimutan, for example, ng isang tricycle driver na hindi bale, hindi naman ako nagkaka-COVID. Totoo po yun. No? Baka hindi ka nagkaka-COVID, pero ang sakay mo araw-araw sa tricycle mo ay yung bata na pumupunta sa eskwelahan. Pag hindi tayo nakalabas dito sa pandemya ito, walang face-to-face classes. Walang batang sasakay sa tricycle mo. Wala kang hahatid mula sa bahay nila hanggang sa eskwela. So indirectly, wala kang kikitain. Let's talk a little about the data on whatever available vaccines there are in the market. And I'll make it as quickly as possible because the next two slides are actually for healthcare workers, but I hope I will make it as understandable to you as possible. So ito po yung mga importanteng bakuna na available po sa mundo at sa bansa. Hindi po available ang Moderna at hindi pa available ang Gamaleya. Ang available lang po yung mga nakaputi. So si CoronaVac, si AstraZeneca, at may approval na si Pfizer, kaya lang hindi pa dumarating. Ang importante po sa lahat na to is I want you to look at the last row which show you that the vaccine efficacy is very good for all of them. As a matter of fact, some people ask, bakit si CoronaVac, si Sinovac, 50.65% lang. That's true. But this data for CoronaVac, for Sinovac's vaccine, was actually based on a study in healthcare workers. Nung ginawa nila itong clinical trial na ito, nung ni-roll out muna nila yung bakuna sa phase 3 ng clinical trial. Ang Pfizer at saka yung sa AstraZeneca, ginawa nila sa general population. So sa lahat ng tao, depende kahit na anong trabaho nagtatrabaho ka sa call center o isang pangkaraniwang housewife ka lang o sa teacher, basta ni-roll out nila kung sinong gusto magpabakuna, doon nila binibigay yung clinical trial na yun. Yung CoronaVac, itong study na to ay ginawa lang sa Brazil. And they only did it in healthcare workers. So that means ito yung mga doktor, nurses, medtech, yung mga frontliner. Hindi lang frontliner, but at the front of the frontliner. And you know how the cases in Brazil are. No? Million ang kaso sa Brazil. at araw-araw, almost 50 to 60. They even had days that they had 100,000 new cases a day. So Brazil is one of those countries where they are burdened extensively with the COVID pandemic. So they did this only in healthcare workers. And they saw that the healthcare workers, at least more than 50% of them, did not even go on to developing mild infection. So they did not get COVID. Itong 50.65%, itong endpoint na to ay magkaroon ng mild COVID. For COVID that is severe or resulting in death, 100% ang protection nilang lahat. So nobody who received the vaccine ever had severe or died of COVID. So our major fear, and I'm sure that is everybody's major fear, is the side effect. Kasi hindi natin kilala eh. Bagong-bago talaga siya. At mas nakakatakot talaga ang hindi natin nakikita. So, yung major fear na yon is a natural feeling for all of us. And it becomes bothersome kasi natatakot tayo in the back of our mind. Pag naturok tayo, baka naman may mangyari sa akin. Kawawa naman yung aking pamilya. Pero mas nakakaawa naman kung nagkaroon ka ng COVID. Kasi dalawa lang naman pagpipilian natin ngayon. Magkaroon o magpagkaroon ng protection. And it's very difficult to come down with COVID. I said, it's not only the mental anguish of coming down with COVID, but it's also the number of people that you infect, especially if you find out that you come down with COVID and then you infect your loved ones. Na-infect mo yung yung lolo mo. Yung lolo mo dahil may edad na, syempre nagkaroon ng severe COVID at yun ang ikinamatay. Nakakatulog ka kaya sa gabi na naiisip yon na ikaw yung naging dahilan kung may bakuna naman na available para sa iyo. Pero hindi mo pinili dahil natatakot ka para sa sarili mo. So, anong nararamdaman pag nabakunahan na tayo? Well, most of the side effects are actually local. No? We call it reactogenicity. What does that mean? That means that you get side effects that our body reacts because of the vaccine. You can either get a local side effect, which includes a little rash on the site of the injection, or pain, syempre masakit, no? On the site of the injection. Or it can be systemic. What does systemic side effect mean? For those that have kids, pag nabakunahan yung bata, yung iba nilalagnat. Yun po, ang tawag po doon ay systemic side effect. And some of the systemic side effects include headache, nausea, muscle aches, fatigue, and a little fever. But that's natural. That's natural. And why is that natural? Well, because our immune system is active. It kicks in. Nare-realize niya na, uy, meron akong kalaban ngayon. So gumagawa siya ng antibodies. And when our body is now stimulated to form antibodies, which will later on serve as protection for us when we get to meet COVID, the virus, that's a good thing because that means that the vaccine works. Okay? Now, if you get severe or serious side effects, then you iimbestigahan kung yung side effect ay dahil sa bakuna. Kasi paring naman may kondisyon yung pasyente na walang kinalaman sa bakuna. Ang benepisyo ng bakuna ay dapat mas marami kaysa sa side effects. So the benefit outweighs all of the risk. And today, most of the side effects are actually local, systemic, and very few. So this is my last slide. Lahat tayo may pangamba. We will never be able to achieve fighting the pandemic if we do it alone. Only if we work together can we defeat an enemy that has claimed lives, ruined economies, changed the way we live, breathe, and be happy. That is why when we get the vaccine, let us remember that we are not doing it for ourselves. Always in our mind, we remember that the reason why I'm getting the job is because it's for you. And that's a story we need to tell, not only for ourselves, but to our children and to succeeding generations if we are going to get out of this pandemic alive. Thank you.
Hi, Doc. Thank you very much for a very, very informative talk. Actually, from our comment section, ang dami pong nagpapasalamat for very insightful talk, no? So, Doc, marami lang tayong a couple of questions here na baka pwede natin isa-isahin para masagot din yung mga katanungan nila. Okay, from Ms. Jigs Pabale, Doc, kung halimbawa po, 3 kaming frontliners dito sa bahay at nakapagpabakuna kami, hindi po ba yon magiging risk para sa mother namin na senior citizen na walang bakuna?
Bakit siya magiging risk? Bongga nga, 3 nga kayo nagpabakuna na. Eh, di wala na. Di ba? At least na-cover na ninyo si mother.
Mm-hmm. Okay. Next question from...
3 kayo nagpabakuna.
Ano po yun?
I said, swerte ninyo, 3 kayo magpapabakuna. At least covered na si mother.
Yes. Okay, next, Doc, from Ms. Jackie Chan. Is it true that Sinovac already tested in other country and show its effectiveness in new variants?
Well, it's like this, no? Sinovac is an inactivated virus. That's a good question. Sinovac is an inactivated virus, and because it is a whole cell, it is more effective, theoretically. Dahil whole cell siya, buo yung virus na yun, pinatay lang. So it is coronavirus, but we just killed the coronavirus. At dahil buo siya, it is sturdier and more effective against variants. So whatever variant there is, mas effective yung inactivated virus kesa sa yung ibang mga klaseng vaccines. But again, what we're saying is whatever vaccine is in front of you, you should be able to get it. Kasi you should not wait for your favorite vaccine. Dahil sa bago dumating yung bakuna na gusto mo, baka magka-COVID na tayo dahil sa dami at sa taas ng kaso natin ngayon.
Alright, Doc. Actually, Doc, marami yung nagtatanong, ano kaya, in your opinion po, what is the best vaccine right now? Assuming na...
that was my answer, no? I think I answered it in the last statement I said. The best vaccine is the one that is in front of you and made available right now. You have to remember all of the vaccines that were made available and have EUA of more than 50% efficacy. It meets that criteria. There are 2 criteria lang naman to meet an EUA. EUA means emergency use authorization. So the Food and Drug Administration will authorize it for emergency use on 2 conditions. One is that it is more than 50% effective. So in preventing mild infections, and they all meet that criteria. And the second is that they are safe. So may safety data siya of more than 2 months. So based on that, lahat sila maganda.
Alright, Doc. Doc, from Ramen Silog, what do you think of ivermectin versus COVID-19?
I like that question. That's not about the vaccines. And I know there's a lot of information on ivermectin being circulated around. Ang daming senior citizens na naniniwala dito. I know a lot of people also believe in it kasi medyo convincing yung nagbebenta nito. Ang ivermectin, kung may aso kayo, ginagamit ko para sa heartworm ng mga aso ko. So it is an antiparasitic. In short, Para siya sa bulate. Ngayon, I do not know its role exactly sa COVID kasi COVID is a virus. So magkaiba yung antiparasitic kasi antiparasitic talaga siya. At magkaiba ang role niya sa virus. Let us take for granted na lang na may papel si ivermectin sa COVID. Number one, ang available lang sa Pilipinas ay yung para sa hayop. Kasi binibili ko yun It's called HeartGuard. So I buy it for my dogs so that they don't get heartworm disease. So the one that's available in the Philippines is a preparation for animals. Now, there are some people that are selling it and saying, ito para sa tao to. There is no registered drug for human use for ivermectin in the Philippines. Which means that it's hindi rehistrado yan sa Pilipinas. It may be registered somewhere else in the world, but it is not registered in the Philippines. But that is dangerous. That's dangerous because number one, it is smuggled. Diba? And when the goods are smuggled, you do not know the integrity of the good. Parang yung Sinopharm. Galit na galit tayo, yung PSG, nakatanggap ng Sinopharm. Pero hindi natin sure kung paano yung gamot na yun. So pag na-break mo yung integrity ng gamot, maaaring hindi na siya mabisa. Isa. Pangalawa, hindi siya rehistrado, so it is considered counterfeit. And therefore, it should not be sold to you. Kasi pag nagkaroon ka ng side effects, at marami ang side effects nito, it can include neurological complications, no? And bleeding. So if you develop complications against it, kanino ka maghahabol? Hindi mo naman pwedeng sabihin, yung doktor nagbenta sa akin, no greater fool than the fool that is fooled by a fool. Diba? Nagpauto ka bumili ka, naniwala ka. And number three, maaaring yung binenta sa'yo, hindi nga umepekto kasi walang laman, placebo. Sinulat lang niya doon, ivermectin. Pero binili mo. Pero gaw-gaw lang yung laman niya. And because of those reasons, I probably will not use it. Unless there is ivermectin for human use in the country. If you look at the ivermectin in the US and other parts of the world, wala doon sa label niya na nakalagay for COVID. So that means that it is being used off-label. Off-label meaning, yung company, hindi niya claim na effective siya for COVID. So hugas kamay siya doon. So at your own risk yun. I hope I answered your question.
Yes, Doc. Actually, since we're in this area na rin po, what do you think about lianhua? As I think that's a Chinese medicine.
That's registered in the Philippines, but that's the use of that herbal preparation is more as an antipyretic, para sa shosho, no? It's used for fever, and it's like a medication for flu. So it addresses the flu-like symptoms in patients that have COVID. But you have to remember kasi it's very difficult, no? You have 90% of patients who have COVID, 90% to 95% of patients who have COVID are usually, actually about 90% are mild. 5% are asymptomatic. So, mahirap din sabihin na pag ininom mo yung ivermectin, gumaling ka dahil sa ivermectin. Kasi maaring nandun ka sa population o yung linhua that when you took it, gumaling ka dahil dun sa gamot na yon. Kasi most of the time, gagaling ka Gagaling ka on your own. Ang problema lang is nakakahawa siya at 14 na araw ang quarantine time mo. Because you are infected for quite some time. And the problem is, if you infect a population that is vulnerable, katulad ng mga matatanda, o yung mga bata, o yung mga nagkakaroon ng yung mga may sakit, baka mamayang konti, sila talaga ang nadadali, sila ang namamatay, nagkakaroon ng komplikasyon. Mas marami sa kanila nagkakaroon ng komplikasyon dahil sa COVID.
I see, Doc. Okay, moving on to the next questions from Miss Christine Bawao and actually from Miss Jen Yu also. How young is the age na pwede na pong mag-vaccinate, mapag-vaccinate?
Well, if you give the other vaccines, it's 18. The only one that's approved 16 and above is Pfizer and Moderna's vaccine. Pfizer's vaccine, actually.
Okay, so for Sinovac and AstraZeneca, what's the age limit?
The age group is 18 and up for both of the vaccines. I know Sinovac is not approved in the Philippines for 60 years old and up. But there is data to show that it is effective even in the elderly. They've not come up with the studies yet, but their phase 1 and 2 clinical trials show that it has the same vaccine efficacy in those 60 years old up and those between 18 to 59. And let me put something in perspective kasi some people always put an age range. Ang problema niyan is that, age is just a number. Kasi there are people that are 65 and yet they have the body of a 35-year-old. Diba? 65 years old pero grabe, lakas-lakas siya, hindi siya mukhang 65. Pero iba na 35 years old, pero akala mo 80 anyos na, mataba, hypertensive, may hinihingal na araw-araw, ang dami niyang problema. May diabetes, may kidney disease. So yung katawan niya, yung biologic age niya is that of a 90-year-old. But you have a 65-year-old who can have a biological body age that is that of a 35. So the immune response is almost the same way because our immunity depends on our biology. So using the 18 to 59 numerical age is very arbitrary.
Okay. Next question from Welly Gunn. Are there studies which type of persons who are susceptible to develop severe symptoms so we can know who should do extra measures and self-quarantine and be vaccinated early? Most other population seems to get by without difficulty so they can wait later for the vaccination.
No. Actually, the more susceptible individuals are those that work in the front, in the front of the front line. Sila yung highest risk. Kasi syempre, araw-araw, mas mataas ang risk nila dahil yung mga nakikita nilang mga pasyente o mga nakakasalimuho nilang mga tao ay yung mga may sakit. So they are at the highest risk. And that's the reason why you see in other countries, katulad in Europe, in the United States, and in all of the other countries, yung mga tinatamaan na nursing homes, yung mga may mga matatanda na doon na nilalagay ng mga pamilya nila yung kanilang matatanda na magulang kasi hindi na nila naalagaan. Hindi katulad dito sa Pilipinas, nasa bahay natin yung mga matatanda eh. Sa ibang parte ng mundo, we put the elderly in a nursing home. And if there is one death in the nursing home due to COVID, there are almost everybody in that nursing home die simultaneously. Imagine you have one healthcare worker who brings COVID there. That will wipe out the whole nursing home.
Okay. Next question from Ms. Juliet Paat. Good afternoon po, Doc. Doc, kailangan po bang i-refer muna ang aking epileptic son sa kanyang neurologist bago po pabakunahan? Thank you.
In the first place, if your son is less than 18, hindi siya pwede magpabakuna sa COVID. Diba? Now, if you are referring to it as a general rule na you have a son and you want him immunized for other vaccines, no, you don't need to refer to a neurologist to get the vaccine. Not all of the vaccines kasi will cause fever. And not all fever. Kasi sabi mo, epileptic yung anak mo eh. Epilepsy is not the same as benign febrile seizures. Benign febrile seizure is seizures or convulsion secondary to fever episode. So, hindi magkapareho yung dalawa. Epilepsy is a neurologic condition. So, you don't need to refer.
Okay. Next question from Miss Frida Lim Chua. Hi, Doc. Pwede po bang magpa-vaccinate ang mga breastfeeding moms?
Yes. The answer there is yes. For most of the studies, the vaccine will not cross the breast milk, so it's okay for pregnancy and lactation, especially during the second and third trimester of pregnancy. So pwede ka, kunyari, kalat na kalat ang COVID doon sa bansa, no? O doon sa lugar na tinitirhan ninyo. At sa 15 kapitbahay mo, 10 na sa mga kapitbahay mo meron, 5 na lang ang pamilya na wala, isa yung pamilya ninyo. So the vaccine will benefit you. If you are in your first trimester of pregnancy, you cannot get immunized because that's the time na nagpo-form pa yung mga body parts ng anak mo. Pero in the second trimester, formed na, we call it organogenesis, no? In the first trimester. In the second trimester, all of the organs have formed already. So you're just waiting for it to grow. So there is no harm if you get vaccinated in the second and the third trimester of pregnancy.
Okay. Next question from Willie Gian again. Yung nag-positive po na po sa rapid antigen test dati, kailangan pa po ba magpabakuna?
I don't use rapid antigen tests, and because I do not know why you did. Dapat PCR talaga. But let us take for granted na nag-rapid antigen test ka, tapos nagkaroon ka ng COVID, at supposedly positive ang PCR mo. Kasi pangit talaga ang antigen test. Ang daming tao gumagamit nito dahil mas mura. I think the better question there is, kung nagka-COVID ka na, kailangan mo pa ba magpabakuna? The answer is yes. There's an excellent study that shows that your antibodies, if you have had COVID, eventually wane, nawawala yung antibody protection mo. So parang sa bakuna, mawawala din yung epekto ng bakuna after a year. So we might need to get boosters next year. So in the same way, pag nagkaroon ka ng COVID, dahil isang beses ka lang nagkaroon, the antibodies will wane. The average duration of waning is 5 months. So within 5 months' time, on the average, wala ka ng antibodies sa COVID. Now, the earliest time na nawawalan ka ng antibodies is 3 months. So yung range niya is 3 months to 8 months, maaring wala ka ng proteksyon kahit na nagkaroon ka ng COVID. That's the reason why the recommendation is, if you have had COVID in the past, get immunized 3 months later. So kung nagkaroon ka na ng COVID, kailangan mabakunahan ka pa. Pero maghihintay ka ng 3 buwan.
Doc?
Yes.
I think we're having
Hi, Doc. I think nagkaroon lang ng konting problem, no? So, Doc, ang ibig sabihin ba niyan pagka ganyan, ibig sabihin, pag nag-shot ka na ng after 1 year, mawawala, you have to redo your shots then?
The recommendation is that you will eventually have to get boosters annually. And especially with the circulating variants, what will happen is you may need to get new shots yearly. It's like flu, no? Kasi nag-iiba yung strain. So pag nag-iiba yung strain, gagawa yung manufacturer ng bagong bakuna laban doon sa mga circulating new variants. Ako ba yung nawala o si...
Hindi, nawala si Rosh saglit. Pero
alam ko ako yung nawala eh. Sorry.
Doc, may isa pang question. Ano bang mas effective? Gaano ba ka-accurate ang antigen test? Kasi maraming lumalabas na note na it's 95% effective na comparable na raw sa PCR.
Yes. The antigen test is useful only if you have symptoms. But if you do not have symptoms, it's useless. Kasi may asymptomatic, tandaan mo. Di ba?
Yes.
So,
Yes,
magandang
so, halimbawa,
pag positive ang antigen test, okay. So that means you have COVID. Pag may symptoms ka, pag wala kang symptoms at nagpa-antigen test ka at lumabas negative yung antigen test mo, magpapaswab ka pa din. So doble gastos siya.
yes. Pero is it a good measure para malaman lang kung halimbawa nagmamadali ka na malaman talaga kung positive ka or hindi? Kasi ngayon
Hindi.
marami raw hospitals na nagsasabi without a test, hindi ka nila tatanggapin. Parang gano'n.
Hindi. The antigen test is useless. So it's still the PCR. That's useful. Like I said, if the antigen test is positive, useful siya. But if the antigen test is to as well.
Doc, I think this time
So-
ikaw naman yung internet. Yan. Okay na, Doc.
Okay. Is it alright na? Kasi nag-fluctuate internet always.
Yes, Doc. Medyo mas naiintindihan na po ngayon. Thank you, Doc. Ma'am Rosh, maybe you can continue with it na. Exit na muna ulit ako.
Ayan. Doc, does that goes the same with regards to yung saliva testing ngayon?
The saliva testing has been tested, which means the saliva test uses PCR also. But you have to use the one from the Red Cross. Kasi sila lang yung may kit na validate ng RITM.
I see. Okay. Next question from Miss Susan Ngo. Does it follow that the 2 shots vaccine should be of the same brand? What will happen if you had 2 different brands because of availability?
Yes, it should be the same brand. If you get 2 different platforms, you will have to complete one of the platforms. So that means that nag-sign pa kayo. Tapos wala nang Sinovac, AstraZeneca ang sumunod. Wala nang AstraZeneca, ang Pfizer ang sumunod. So magpapaksa ka ng kung ano yung team mo, progress ka magpapaksa.
Doc, I think the signal is worse than before. Medyo hindi na po kayo naiintindihan. Can you repeat that the answer for that question po?
Are you having technical problems? My side.
Yes, Doc, I think it's on your side na po.
Okay, let me try and do this.
Okay. And habang nagre-reconnect si Doc, feel free to send us your questions. Pagpasensyahan nyo na po, this is a normal situation here in the Philippines kung saan talagang medyo laging may connection problems. No? So hopefully magiging better na rin yan. So maraming salamat again sa lahat ng who are taking their time to be with us today and sending us your questions. Nako, this is a very good opportunity for us na malaman natin yung mga sagot from a real expert, no? Hindi yung marami lang tayo nakikita sa mga Facebook feeds, mga news na gano'n. This is a very, very good time na makakuha na tayo ng information from someone who is
Knowledgeable.
sure about the information. Yes. Ito na si Doc.
Okay.
Yan.
Is it clear now?
Yes.
Yes, Doc.
Better.
All right. Okay. So, naka 5G na tayo.
Nakakaingit naman yun, Doc. Dito sa Binondo hanggang 4G lang.
Well, here, naka 5G na ako. Okay. I hope this is clearer. Sige.
Yes. Ayun, Doc, going back to the last question.
Yes. So, that means that you need to complete 2 shots of the same brand. There are no studies that shift from brand to brand. So wala pong ganyan. Kasi tatandaan mo, iba-iba. Kaya ko pinaliwanag, iba yung platform. Hindi ka pwede mag-inactivated, tapos magva-viral vector, tapos mag-mRNA, tapos hindi. Kailangan mo makompleto lahat. Kaya nga mas maganda yung one shot. At iilan lang sila na meron yung one-shot vaccine. Yung sa Johnson & Johnson, isa yon. Yung sa CanSino Bio, pangalawa yon. So there are very few. Yung sa Gamaleya, gumagawa sila ngayon ng Sputnik Light, ang tawag nila doon. Yung Sputnik V ang original nila. So, pangatlo yon. So, the vaccines that have a single shot will actually benefit us more. Kasi, ang hirap pabalikin ang mga pasyente para magpabakuna. At naiintindihan ko yon. Kaya lang, dahil kulang nga tayo sa supply ng bakuna, please stick to the vaccine that you got. Usually, yung mag-o-order para sa inyo, ang bilang niyan, kaya nga ang bilang namin doses, di ba? Pag sinasabi ni Secretary Galvez, dumating 100,000 doses. Ang ibig sabihin nun, 50,000 tao lang ang makakatanggap nun. Kasi hindi 100,000 vials ang dumating, 100,000 doses lang.
So, Doc, what will happen if, for example, nagpa-shot tayo ng Sinovac and then after 2 weeks, nagpa-shot naman tayo ng Astras? Magkakaroon ba ng complications or whatnot?
Not really, but I don't think the vaccine will be that effective. Theoretically, it should be. It's just that you want your immune response to be something that has recognized the previous vaccine. Kaya if you give another vaccine from a different platform, it might not elicit the same immune response. Yun lang ang worry ko. And it might cause side effects kasi the side effects of one will not be the same as the side effects of another brand or another platform. So baka masabi ninyo, ay, naku, ang sama ng side effect nito. And then you will start blaming the vaccines. But that's because you were changing platforms left and right. So it's not recommended that you change vaccine platforms.
Doc, isang follow-up question regarding that. Merong iba, halimbawa, narinig namin before na parang ang nangyari, instead na 2 shots yung na-allocate sa bawat isang tao, parang para lahat lang magkaroon is parang ginawang one shot muna. I think it was done before in the US if I'm not mistaken. Anong magiging problems doon just in case hindi mo makuha yung second shot on time?
Well, major problem yun kasi all of the vaccine clinical trials, ang endpoint niya second shot eh. Diba? So it might not give you a full immune response. So in short, if I claim that my vaccine is 90% effective, it's 90% effective because I got 2 doses. Now, I don't know if I just get 1 dose. And I don't know how long I will get protected if I just get 1 dose.
Tapos, Doc, meron pang isa, di ba? Problem nga lagi yung pagpapabalik ng tao, ng patient natin to get the second dose. So what would happen if they get a second dose pero it's not within the correct time frame? Di ba meron siyang after ilang linggo dapat bumalik ka to get your second dose?
Yes, we just continue the second dose. Normally, may flexibility naman yan eh. So even if I tell you it should be given 3 weeks after, that's because of the clinical trials. No? Pwede naman, allowable naman na, kunyari 4 weeks siya bumalik, bigay mo na yung kanyang second dose on 4 weeks. The AstraZeneca is now recommended on a 12-week interval. So that means after getting the first dose, you wait for 3 months before you get the second dose.
Thank you very much.
Yes, Doc. With regards to that, if for example, first dose lang, is it after 12 weeks, diba? Pag first 1 dose lang yung kinuha niya, possible na hindi siya maging, kasi we've heard from other talks din na kapag yung first dose is usually hindi pa siya effective. Parang yung second dose talaga yung magkakaroon ka ng mga side effects, ganyan. The first dose is, hindi ko alam, pang prep or something.
You see the first, with regards to side effect, you see the first dose not eliciting a lot of side effects, and the second dose having more side effects only in the mRNA vaccines. Ito yung sa Pfizer at Moderna, but not with the other vaccine platforms.
Okay.
So, dun sa Pfizer at Moderna, peculiar sa kanya na yung pangalawang dose mo, maghanda-handa ka na kasi para siyang turbulent storm.
Okay.
Pero it will not last. It's like 3 days and then okay ka na.
So, another question, Doc. May iba kasi since ngayon ang available is Sinovac. They get vaccinated with Sinovac, okay? Done na with 2 doses. And then after a few months, dumating yung another brand and they want to get vaccinated as well. Is that possible or is that okay?
Sure. Basta nakumpleto mo yung una, fine.
I see. Okay. Next question, Doc, from Mr. Harvey Ho. My dad is taking Plavix for blood thinner, Crestor and Duodart. Now at 71, he had 2 stents 2 years ago. Do you think it's okay to get vaccinated with Sinovac, or does he have to stop the above medicine first while starting on the day of vaccination?
Well, there's no problem for number one. Sinovac has not been approved for the elderly. Actually, what they've done is they've increased the age of Sinovac at about 65. So, yung iba, they have allowed it to be given up to 65 years old. But there is still no data in more than 65 years old and up. On your question, I guess it should be safe. Kasi ang inactivated vaccine will not cause bleeding problems. It's the viral vector vaccines. Kaya nga pinull out ang AstraZeneca sa Europe, in many countries in Europe, because of patients who may have bleeding problems, yung mga naka blood thinners, yung mga naka aspirin, naka Plavix, yung mga for clotting problems yan. So bleeding problems will arise among those patients. So I don't think there will be a problem with inactivated vaccine. It's just that your dad does not fit the age na pwede siyang bigyan, pero if he's willing to get it, then it's, alam mo, of all of them, the safest is the inactivated vaccine.
Okay. So, Doc, since ang recommended age for Sinovac, for example, is until 60 or 60 years old, right?
Yeah, the current recommendation is 18 to 59.
Yes, Doc. So, what if, for example, his dad agrees to have himself vaccinated?
He just signs a waiver.
Just a waiver from the hospital, then, Doc.
Yeah. Now you're willing to receive it.
All right. Okay. Hello, Doc. Kung nag-positive sa PCR test, ilang months after bago pwede magpa-vaccine? 3 months. Okay. Safe po ba magpabakuna ang isang stroke patient na pre-diabetic and may adenomyoma? Sorry, adenomyoma.
Magandang tanong yan. Kaya lang kasi there are a few things that you want to consider, no? Yung mga highest risk, dapat may clearance ka mula sa doktor mo. Kasi some of the medicines you may be taking may pose a problem when getting vaccinated, number 1. Number 2, you need to think also of the condition of the patient. I hate saying this, but I will be blunt. Isipin mo, kung yung taong yun mabubuhay pa in the next 6 months. Kasi, baka naman there is no more benefit in having the patient immunized. Lalo na kung metaning na yung mga buhay ng iba na gusto natin bakunahan. I go back to the point that instead of having those that are at highest risk immunized, I think we should get immunized ourselves, especially if we take care of those that are at high risk. Kasi kung hindi tayo magkakasakit, hindi naman sila magkakasakit eh. Nakaratay lang sila. Hindi naman sila gumagalaw. Diba? So that's more important for me. Okay. Kung minsan natatakot tayo, si tatay na lang. Yan na lang, pabakuna mo. Diba? High risk ka naman tayo, ikaw na mauna.
Okay. Sige, Doc. Next question. For those who decide to get vaccinated, what is the process? Whom to contact and where to go to? How much to pay?
That I don't know. Well, number one, the local government unit should give it to you for free. We pay our taxes, and I know the government has a national plan in rolling it out. Now, if you have employers that are kind enough to buy for you the vaccine, then very good. Because what your employers will do is they will buy the vaccine for you. And when the employers do that, they do it out of the kindness of their heart. So take advantage of your employer who is willing to buy the vaccines for you.
So Doc, wala pa yung private, let's say, ako personally, I want to buy a vaccine for myself or for my family. Wala pang avenue on where we can reserve or buy.
I think meron. I know there is, and I know the Philippine Chinese Chamber, the Philippine Chinese Federation, something, is pooling for Sinovac. I know ICTSI of Enrique Razon and the Marketing Association of the Philippines of the Ayalas are pooling for Moderna. I know Unilab is pooling for Novavax. Yeah, so you can go through these avenues and ask them if you can join in the pool.
Yeah. Just to add lang, no, Doc, meron ding mga, as you mentioned kay na LGU, I think may registration din for mga
Yes,
gusto
yeah.
mag-vaccinate.
Yes.
Okay.
At libre yan sa local government.
Yes. Okay. Next question from Sir Neil Fernandez Perez. Hi, Doc. We are currently here in Riyadh, Saudi. We're going to have our first dose of vaccine, AstraZeneca here, and the second dose will be scheduled by first week of June. But we are flying back to the Philippines by second week of April. My question is there a chance to have our second dose here?
Here in the Philippines, no, you cannot. Kasi wala pa kaming bakuna dito. Ang rollout ng AstraZeneca vaccine dito ay para sa healthcare worker lang. So kung hindi ka healthcare worker at hindi ka nagtatrabaho at hindi ka frontliner dito sa Manila, hindi ka entitled doon sa bakuna. You should have received also the first vaccine here before you can get the second vaccine here as well. So no, we've not rolled it out. You stay in Riyadh na lang for a while and then get the shots there before you come home.
Yes.
Or you don't get the shots at all.
And wait for it in the Philippines.
Yes, or wait and then wait out here.
Okay. Okay. What else? From Miss Irene Ting, is it safe to have the vaccine if I have also just had another vaccine shot? I just had my second hepatitis B shot and due for the third dose by June. Also, are there reservations on using AstraZeneca since 3 countries in Europe have suspended use of it due to blood clots?
The Europeans are Europeans. There is also geopolitics in vaccine. And when I talk about geopolitics in vaccine, the Europeans will only take what they want and the Americans will only take what they want. You will never see an American buy Chinese vaccine or Russian vaccine. That's the reason why meron sila si Moderna at saka si Pfizer lang. And in the same way, the Europeans, it is the UK that sticks to the AstraZeneca and South Africa, diba? But the other parts in Europe, medyo ayaw nila sa British eh. Bakit? Kasi di ba kumalas sila sa EU? Oh, may away sila eh. So it's called geopolitics. On the question of, what was her original question?
Shot po siya ng hepatitis B, second dose na, and scheduled for a third dose in soon.
If you're going to receive other vaccines in between your COVID vaccine, there should be a 2-week interval. So, kunyari, you will receive Hep B. 2 weeks later, you can get your COVID. And then 2 weeks after, you can get any other vaccine. Like you can get flu, you can get... Basta 2 weeks ang interval before or after a COVID vaccine.
Okay. Thanks, Doc. From Miss Celia Oates. Good PM, Doc. Kung may asthma po or high blood, pwede po bang magpa-vaccine? Salamat
Of
po.
course.
Of course. Okay.
Doc, may mga natanong lang na questions from RV Ho. Hello, Doc. I have another question. My mom is 64 years old, breast cancer 6 years ago, had undergone chemotherapy and radiation. She's now taking Euthyrox, Tragenta, Zinova 7, Glucophage XR. Is it okay to take Sinovac?
I think you will need to get clearance from your doctor. If your doctor tells you, kasi I do not know all the medical conditions, you can tell me all of the names of all the medicines you are taking. But if I do not know your full medical condition, I will not be in the right place to tell you whether your mother, your father, your brother, your sister, or your relatives can get the vaccine or not. As a general rule, anybody can receive the vaccine. There are only 3 exceptions to the rule. The only 3 exceptions to the rule are: number 1, if you are a child, okay, kasi walang indication sa bata yung bakuna. Number 2, if you have an allergy to the first vaccine shot that you got, so if it's the first time na natanggap mo, tapos nagkaroon ka ng allergic reaction na severe at nagkaroon ka ng anaphylactic shock, dinala ka sa ospital, na-intubate ka, ni-resuscitate ka, binigyan ka ng gamot dahil nagka-allergy ka sa bakuna, you cannot receive any vaccine in the future. And the third condition is if you are allergic to polysorbate, that is a substance that is found in the vaccine. So if you're allergic to both polysorbate and polyethylene glycol, you cannot receive any of the vaccines. Yun lang po yung 3 indication kung bakit ka hindi pwedeng mabakunahan. All of the other conditions, any other condition, pwede kang mabakunahan.
So, Doc, ang bata hindi pwedeng mag-sign ng waiver ng parents para mabakunahan?
Hindi.
Okay. Thank you, Doc.
Walang karapatan ng magulang i-buwis ang buhay ng anak niya. Bakit mo naman gustong pasaksak yung anak mo? Ikaw, di ba I've told you that? Ikaw ang magpasaksak para hindi magkasakit yung anak mo. Imagine, bubuwis mo yung, anak, ikaw na muna. Saka na lang si tatay. Di ba? Ganun yung attitude natin. Takot ako eh. Lahat ng kamag-anak mo, pinasaksak mo na, pero ikaw. Para ikaw yung protektado, hindi. Pasaksak tayo para protektado. Lahat tayo magpapabakuna para protektado ng pamilya.
Pero Doc, that goes to say na yung mga bata don't go out then of their houses, no?
Well, kasi eventually, when all the adults, you see, you have to remember the transmission of COVID is adult. Mm-hmm. Sila pinanggagalingan ng COVID eh. Bihira nga manggaling sa bata eh. Di ba?
Okay. Sige, Doc. Next question from I'm Rich Martel. Is it safe for special child with Down syndrome and pregnant women?
At diba sabi ko bawal nga sa bata pa. Unless yung special child mo na may Downs, more than 18 years old na. So kung may 18 years old na yung Downs mo, pwede naman siyang matanggap ng bakuna. Just because you have Downs does not mean you cannot get vaccinated.
Mm-hmm. And for pregnant women,
I've said that you can get the vaccine if you're in the 2nd and 3rd trimester. So there are conditions wherein you can get the vaccine, but you will have to wait for a while. 1, if you are sick. So if you have COVID, you cannot get it. 2, if you have recovered from COVID, you cannot get it yet. You have to wait for 3 months. 3, if you receive convalescent plasma or you receive the monoclonal antibody for the treatment of COVID, so you'll have to wait 3 months until you've gotten better before you can receive COVID vaccine. 4, if you are pregnant in the 1st trimester, you cannot receive it. You have to wait until the 2nd trimester before you can receive the vaccine. Okay? So these are conditions, or 5, when you've been exposed to somebody who has had COVID in the last 2 weeks. So if you got exposed to somebody who has had COVID in the last 2 weeks, baka may COVID ka na din, nag-i-incubate ka lang. So alam niyo yung ibig sabihin na nag-incubate. So wala ka pang sintomas. Dahil ka-expose mo pa lang in the last 2 weeks. So you wait until 2 weeks after. Kung you don't develop any symptoms, then go ahead and get immunized. But wait for 2 weeks.
Okay. So Doc, with regards to yung pregnant, for example, pag nasa second trimester or third trimester, if she gets vaccinated, will the antibodies go to parang magiging parang immune din ba si baby?
Sana. There's actually a very good study that showed that the moms that got immunized, when they looked at the babies and then they did, kasi sa States meron na di ba? Well, after delivery, they looked at the antibody levels. It's called PRNT, no? Neutralizing antibodies of the babies. They found out that the babies have antibodies already against COVID. So that's a good thing, di ba?
What about Doc pag kunwari, breastfeeding mom? And then
the antibody will not go through the breast milk.
wala.
No.
Okay.
No.
Okay, sige. Next, Doc, from Aishima Omiyage, pwede po bang magpa-inject, Doc, pag may allergy sa food or medicine?
Yes, I have allergies to food and medicine. And yet, nagpa-immunize ako. Kaya naman.
Mm-hmm. Unless siguro kung sobrang
No, the only allergy that is contraindicated is if you're allergic to the two things I told you, polysorbate and polyethylene glycol. They are two chemicals that are found in high concentrations in the vaccine.
Mm-hmm. Next question from Smonet and Ara Bautista. Good afternoon po. Di po ba dapat effective yung vaccine instead of efficacy?
You're talking about vaccine efficacy versus vaccine effectiveness. Vaccine efficacy is a term we use for clinical trial results. So all of the data that we're showing you, yung 95% vaccine efficacy, 80% vaccine efficacy, 50.6% vaccine efficacy, are data from a clinical trial. Okay? So the only way we can gauge how the efficacy of a vaccine is based on a clinical study. When we talk about effectiveness, that's a measurement in the real world. That's very difficult to do. So if the vaccine efficacy is high, it most probably will be lower in the real world. Kasi in the real world, now we give the vaccine to everyone, regardless of the physical condition, regardless of the health condition of the person. So it is expected that the vaccine efficacy will eventually, in the real world, when it gets rolled out, be much lower. And that's what you call vaccine effectiveness. Bibilangin mo na yun. Kasi doon sa clinical trial, marami kang except eh. Hindi mo sinama yung mga may hypertension, hindi mo sinama yung ibang population, hindi mo sinama yung mga bata, hindi mo sinama yung sobrang tanda, hindi mo sinama yung mga sakang, basta yung mga may sakit, hindi mo sinama. Di ba? So maganda sila eh. Ma-measure mo kaagad yung kanya, may gagaling pala siya, protektado siya dito. But in the real world, that's not what you do. You just give it left and right. Wala, pila-pila na. Di ba? Yeah.
Okay, no. Next question from Oliver Granada. Kakatapos ko lang noong January 6 to January 12, severe COVID pneumonia. Vaccinated na rin ng pneumococcal. Maaari po ba akong magpa-inject ng COVID-19 vaccine? Wala po ba itong reaction sa naunang vaccine?
January, February, March. Maaga pa. Hindi ka pa pasok.
Kulang pa.
Di ba I told you, 3 months?
3 months. So, mga 1 month after pa.
Yeah. Kung meron ng bakuna para sa general public in 1 month, then
go. Yeah. So, does that mean, Doc, na every 3 months parang kailangan nawawala yung effectivity ng antibody?
No, that's the reason why. You remember, that's the reason why the vaccines are designed to have a second shot. Parang it simulates that you have a second COVID infection. Kasi usually, if you have multiple COVID infections, the antibodies are more sustained. What you want to do is you want to build up an immune system where there is sustainability of the antibodies. Hindi yung magpo-form ng antibodies,
Oh, wala.
tapos mawawala din yung mga antibodies na yun.
Okay. Doc, is it safe for person with idiopathic thrombocytopenia?
Cytopenia.
Cytopenia, sorry. Will it
Yes.
not cause bleeding? I have a history of nose bleeding, severe.
I don't think it will cause. If your platelets are too low at the time that you get immunized, I would suggest that you consult again your physician if kailangan, kung pwede ka magpabakuna. Patients who have ITP or idiopathic thrombocytopenic purpura have low platelet count. But it does not mean that just because your platelets are low, you will bleed. Okay, so, but you may want to consult first your doctor if he or she will allow you, and it will depend on the level of platelets at the time that you get immunized.
Okay. Next question from Jose Ekem. Hi, Doc. Ilan days ang second dose from the first dose sa Sinovac vaccine and also AstraZeneca?
4 weeks for Sinovac, 12 weeks for AstraZeneca.
Okay. Doc, may nagtatanong pa, what vaccine did you take?
Sinovac.
Sinovac.
That was the first available. I told you, kung anong first available, grab the opportunity. You either grab COVID or you grab the vaccine. It's a no-brainer. No-brainer yan.
Doc, from your experience, did you have any side effects or first dose pa lang po ba yung na-vaccinate?
First dose, no pain, nothing, except on the second day, parang I felt very tired. Parang pagod na pagod, sleepy. It was unusually tired because even though I hold, kasi that day I had one webinar, I had one TV interview, I had one radio interview. So I thought it was just the interviews and the webinar, but it was unusual. When I went home, I just lay down in bed and I was asleep for almost 1.5 hours, which is highly unusual for me. So the fatigue siguro, I attributed it to the vaccine. But that was it. After the next day, I was up and about na.
Okay.
And I was expecting the worst, actually. Sabi ko, okay, let's wait for the storm. Pero hindi naman.
That's good now. Okay.
Yeah.
Yes. Next question. If taking antiviral, pwede po bang magpa-vaccine?
Ano antiviral naman iinumin mo? It depends on the antiviral that you're taking, but as a general rule, you can go ahead and take you can get vaccinated even if you're on an antiviral medication. We do not have antiviral meds kasi for COVID. So none of the antiviral meds actually work for COVID. So yes, you can get immunized if you're taking an antiviral medication.
Okay, good. Next question from Ms. Dara Delgado. Hello, Doc. I was scheduled to have my vaccine since I'm a nurse, but my BP before the vaccination was 140/100. So I was advised to come back tomorrow. I had my BP checked again at around 12 noon sa workplace ko po, 120/90. What will happen if I still get 140/100 tomorrow? Deferred na naman po ba ako and will be rescheduled again?
Baka natatakot ka lang. Huwag ka matakot. Breathe in, breathe out ka.
Okay. Kay Ma'am Rosana Ong, can an 87-year-old Lola get the vaccine also? Which vaccine ang bagay sa kanya if ever pwede?
It depends on the vaccine. I think the age, I keep going back. I think the biologic age is very important, no? You have to look at the body of the 87-year-old Lola. Sometimes you will be surprised. The 87-year-olds are stronger than some of us. And I will give you the perfect example. The Queen of England is 94. Oh,
And she got vaccinated.
and she got vaccinated. Oh, so what is wrong with an 80-year-old getting vaccinated?
Correct.
Gamitin mo na lang benchmark ang Reyna.
And she used AstraZeneca po ba?
No, I think she used Pfizer. They will not tell you
Okay.
They will not divulge.
Sige. Next question, Doc. Good PM po. Kailangan po ba munang magpa-antibodies test before getting the vaccine? Thank you, Doc.
No. Like I said, no, in the real world, dun sa tunay na buhay, hindi na po tayo nagpapa-antibody test. Kasi in the real world, we don't need any testing done. It is presumed that we never had COVID in the past.
Okay. But Doc, if ever po nagkaroon sila ng COVID and they didn't know, what will be the effect if they get themselves vaccinated?
Nothing.
So, okay lang naman siya. Even if medyo malapit siya from the time they had COVID.
Yeah.
Okay. Next question. Many employers are offering to sponsor vaccine for workers and residents in their neighborhood for their own general protection. What is the process?
I don't know. You will have to ask your employers that.
I think that's a question for a different group. No? Kasi merong mga iba-ibang Philippine FFCCCII, nagpo-pooling yun nga sasabi ni Doc kanina. There are several business groups that are pooling din. So maybe they can get in touch with them.
Yeah.
Yes. Okay. Meron po bang available na peer-reviewed data on Sinovac?
Meron. Sa Lancet. It's published in the Lancet for phase 1 and 2 of the clinical trials. It was published February 21, 2021.
Okay. From Nicole Chan, given a choice between the two currently available, because we were given a choice by the hospital, which one would you suggest?
Whichever is available. I keep going back to the point. Whichever is available.
I think
if you're young, basta ganito, if you're young, if you're between 18 and 59 as a general rule, I'd get Sinovac.
Okay. Clear.
You leave AstraZeneca to the elderly kasi sila lang yung may additional data in older people. Yan.
Okay. Next po, from Miss Helen. Thank you, Doc. I'm a physician, retired, no hospital affiliation. Is there any way she can get vaccinated daw po? Kasi she wants to be vaccinated.
Baka through the LGUs.
Wala na siya through the hospital, no?
Yeah, I don't think the hospital will allow it, considering the fact that you're not practicing anymore. And you're not affiliated with them.
Okay. Doc, diabetic patient po kami ng Cisco. Paano po kaya? What's the best vaccine for us? At may heart condition.
Whether you're hypertensive, whether you're diabetic, that's not a contraindication to getting immunized. We all have diabetes. Wala nang magpabakuna. Ilang porsyento ng Pilipinas may diabetes at saka hypertension kaya. Di ba?
Doc, actually,
talaga tayo pag may rason. We have reasons not to get immunized. Kung gugustuhin, may paraan. Kung talagang ayaw, maraming dahilan.
Doc, ito merong nag-chat sa akin personal friend of mine. Nagtatanong lang, totoo raw ba na nakakabaog magpabakuna?
That's really I do not know what you have to hide about your manhood. Gusto mo ba magka-COVID o gusto mo magkaroon mabaog na lang? Kasi it's a choice between the two. But definitely there is no truth that it will cause any fertility problems. That's not true.
So ibig sabihin hindi nakakabaog?
Hindi nakakabaog. Kahit naman, kunyari sabihin na natin, example na makakabaog ang isang bagay. Pero mamimili ka lang naman kung nagka-COVID ka, mamamatay ka naman. Aanin mo naman yung fan mo kung mamamatay ka din, di ba? Not a difficult choice to make. But I guarantee you, hindi ka mababaog, promise.
Yun. Ayan na, kung sino yung nag-text sa akin, alam mo na yung sagot ha.
Okay. Okay. Skip ko lang yung ibang questions, Doc, kasi medyo same-same. ano,
Yes.
are those vaccinated?
Dok, ito may isang question habang naghanap siya ng question. Ang sabi niya, halimbawa tinamaan na raw siya ng COVID. Is it possible na, ewan ko, takot yata sa injection to na, sabi niya pwede raw bang yung vaccine niya is like a booster shot na lang, na one shot na lang?
Actually, that's a very good point. There are several studies now that show, it's called a preprint study, no? Hindi pa napapublish, that show that if you've had COVID in the past, you may need only one vaccine. You may not need 2 doses at all. But until that has been published and until that recommendation has been made, in the meantime, it is still the 2 doses. But yes, that's a possibility. And most likely that will be the new recommendation moving forward.
Thank you, Doc.
Okay. Okay, next question, Doc, from Miss Jenny Tan. If nagpa-COVID vaccine, need pa ba ng annual flu shot?
Of course, hindi naman ko ang flu vaccine hindi sa COVID vaccine.
Okay. And next question, Doc, when can a COVID patient consider fully recovered?
What do you mean when can
he or she be considered as fully recovered na?
Normally
if positive siya now, pero siguro nawawala na yung symptoms and all, when can you say na, okay, I'm fully recovered?
Okay. We normally use a 14-day time-based. So that means if you've had symptoms, we count you from the first day of the symptom until 14 days after. Okay, so pwede kang, you had fever, example, March 1. So normally you should have been fully recovered by March 15. So we use a time-based scoring. We do not use any more, we do not repeat swabs anymore kasi most of the patients will turn out positive pa din after reswabbing.
Okay. So, Doc, follow-up question lang din niya. For after that fully recovered after 15 days, does that mean pwede na siya lumabas? Is it safe to say na, or may parang meron pa ba tayong buffer time, or how many days from the
Well, if you still have symptoms, I would prefer that you complete 21 complete days. In other countries, they use 21 days. Tayo gumagamit ng 14 days based on the US recommendation. So if you are asymptomatic, the 10 to 14 days is fine.
Okay. The counting starts from the time the symptoms occur.
Yes, the counting starts from the time that the symptoms occur. So, and then you should add 3 days until after, no? Or the counting starts if you're asymptomatic from the time that you test positive. So, kunyari, today ka nag-test. Tapos 10 days from now, wala kang symptoms. Nag-positive ka, 10 araw na nakalipas, wala ka pang symptom. Pwede ka nang ma-consider recovered. Dahil asymptomatic ka.
Okay.
Doc, my question dito. Hi, Doc, is it true that these COVID vaccines are only effective for COVID itself, but increases the rate of other diseases like heart disease?
Again, I did not understand the question.
Is it true that these COVID vaccines are only effective for COVID itself, but increases the rate of other diseases like heart disease? Kumbaga parang it's good for
No,
COVID.
that's not true. I don't know who came up with that. That's another conspiracy theory. It's only going to address COVID. It's not going to address cardiovascular complications.
Thank you.
Okay. Next question from Mr. Carl Galvez. Good afternoon, Doc. As a medical professional, how do you think we can improve the confidence among the people to get vaccinated given the past experiences we had with Dengvaxia? And what if in the event na nag-cause ito ng di magandang epekto sa mga nagpabakuna, sino po ba ang may liabilities? Do you have any idea po? Watching from Basilan po. Thank you.
Well, regarding the liability, there is no liability by anyone because naka-emergency use authorization siya. In short, it is not a commercially available vaccine, and you sign a waiver when you get immunized. Now, if you don't want to get immunized, then don't. As simple as that. Okay, you're not forced to get immunized. We are convincing you to get immunized on your own for the protection, not only of yourself, but for your family. If something happens, then there is nobody else to blame because the vaccines are in an EUA approval stage. So iba ang commercial vaccines. Ang Dengvaxia is a different story. That is political. And that was a very politicized vaccine. In short, some of the patients did not actually die of dengue, unfortunately, did not die of dengue vaccine, but somebody made a story to associate the Dengvaxia together with the deaths of some of the people who received the dengue vaccine. Yeah.
Okay.
So that's an unfortunate and tragic story in our history.
Okay. Next question from Nicole Chen. Dr. Samuel Ang mentioned that you can get another brand of vaccine after 6 months. What is your opinion on this? Can it be done?
Yeah, you can. You can get as many as you want after you complete one. Fine, if you have money and then there's plenty vaccines, sige. Pa-Moderna ka, pa-Pfizer ka. Basta kumpletuhin mo muna yung isa kahit na bigyan ka ng bigyan ng iba.
But, Doc,
There
what's
is no lag time. There is no time in between. You can get as many as you want as long as you complete one. Medyo adik-adik ka, pabigay mo na. I don't know who wants to get all the types of vaccines.
Para sure. Okay, next question. If magpapa-vaccinate majority ng nasa office and some did not because they already recovered from COVID, what are the risks? Is it advisable to be vaccinated or not? I think the question is, kung karamihan nagpa-vaccinate, pero there are some people who refuse to, or let's say nagka-COVID na, is it still advisable?
Nagka-COVID na sila, so what's the problem? They cannot get the shot naman until 3 months later. Diba?
Yeah.
They just recovered from COVID. They cannot get the shot.
Okay. Pero sir, Doc, sorry. What if matagal na sila, or kunwari hindi sila nagka-COVID, but they just refuse to be vaccinated?
And that's fine. That's not your problem. If you want to get vaccinated, don't get influenced by those that don't want to get vaccinated. Remember, you're doing it not for yourself, but for your family. Always think, I'm not doing this for me. Okay? But you should be doing it not only for you, but also for your family. Kasi kung talagang mahal mo yung ibang mahal mo sa buhay, gagawin natin to para sa kanila. Hindi mo pwedeng panoorin lahat ng mga tao dumadaan. Tapos, at the end of the day, pag nanalo tayo sa loto, sasabihin natin, kasama ako. Kasama ako. Pero wala kang ginawa.
Okay.
Tama?
Yes. Okay. If taking medicine as maintenance 2 years ago, undergo po ng angioplasty, advisable po ba magpa-vaccine while taking different medicine? Pwede po ba kahit na ano available na vaccine sa senior, or meron pong specific na vaccines para sa aming seniors? Thank you so much.
There's no, basta the vaccine is approved for senior citizens. You know, the ones that actually have good studies in senior citizens are the mRNA vaccines. More than 20% of the clinical trial population kasi they did it in seniors. So if you want to know the actual number of the population that was used in the clinical trials, ang pinakamataas actually was the mRNA vaccines, yung Pfizer at saka Moderna. Maraming seniors talaga sila ginamitan. So they have very good experience among senior citizens.
Okay.
Last question.
Okay, last question.
Because I have another talk at 4:30.
Okay. Doc, what's the difference of yung Philippine variant na virus? Is it really more contagious, or does it result to more severe COVID cases?
The Philippine variant, there are circulating variants currently. The UK, which is B.1.1.7, the South Africa, which is B.1.1.35, the Brazil variant, which is P.1. And then you have the Central Visayas variant, which is the B.1.128, which is of a Brazilian lineage, not really of the Brazilian property. The three variants I mentioned, Brazil, UK, and South Africa, are we call it VOC, variants of concern, which means because they are variants of concern, they have the potential to cause increased transmission and they are deadlier. So those three are circulating in the Philippines. Kamalas talaga natin. Lahat ng variants pwede meron tayo. No, hindi katulad ng ibang bansa, isa-isa lang yung variant. Tayo talaga hindi. Dadalhin talaga natin. And that's because we have leaky borders. Pangit ang ating Bureau of Immigration, Bureau of Quarantine. So we only have them to blame. The Visayas variant is a VOI, not a VOC. It's a variant of interest, which means we still don't know a lot about this variant. We know that it may increase transmissibility, but we do know now is that it does not increase deaths yet. So it's an interesting variant, something. So there will always be variants and there will always be mutations, no? And this occur when there is an increase or a surge in cases. Dahil nag-surge sa Central Visayas, may variant na lumabas. So it's a variant of interest, not a variant of concern.
Okay.
Yet.
Okay. Sige, thank you very much, Doc. Thank you very much for answering all these questions. Actually, marami pa tayong questions. Pero I think we covered the major questions na at hand. Thank you very much, Doc. Do you have any message for all the people na who might want to get vaccinated, or yung mga naniniwala pa rin na COVID is a scam? Yes, Doc. Maybe words.
Simple lang yung aking take-home message. No, let's get immunized. This is not for us. This is not for our personal interests, but this is for our families. And when a community works together, then and only then can we eradicate this pandemic. We cannot get out of this pandemic if we are all working alone. And vaccines work. And the only way they work is if we get them. Maraming salamat po.
Doc, thank you very much. Maraming salamat. And you really shared your vast knowledge with all our viewers ngayon. No? And isa lang po ang request namin sa lahat ng viewers ngayon, na sana po, lahat po ng nanood ngayon is i-share po natin itong video na to para mas marami pong mas makaalam pa. No? Instead po nag-share tayo ng mga news ng kung ano-ano po about the COVID. Ito po, we have Dr. Benjamin Co here, that is an expert in infectious diseases na talagang sigurado po tayo dun sa mga information na nakuha natin ngayon. And Doc, maraming salamat. Thank you, Doc.
Thank you, Doc.
Everyone.
Thank you, Doc.
Bye-bye.
Thank you.
Samahan namin ay pinalakas ng isang hangarin, puso at damdamin nagkaisa sa gintong layunin, tamang paraan ng pagsagip, iwas sunog ang nais, walang hinihing kapalit, kahit buhay nasa panganib. At kahandaan sa kalamidad na nagbabadya, sunog, lindol, bagyo, baha. TXTFIRE volunteer, laging handa. Tulong sa nangangailangan, buong puso ang pagdahamay. TXTFIRE volunteer, kaibigan, makabagong bayani ng bayan. Kaalaman at kahandaan sa kalamidad na nagbapadya. Sunog, lindol, bagyo, baha. TXTFIRE volunteer, laging handa. TXTFIRE volunteer,